This is from Yolanda saying, drugs have been amongst us ever since. Why only now? The presidency, come to Atlantis and see. Is this about getting votes? I'm not sure if it's about getting votes. We're not trying to get votes here on Morning Live this morning. We're trying to save lives. That's what we are trying to do as a program. So let's just be positive and let's focus on that. Tell us the areas that you feel need some help. I know we asked this a while back, and the response, I know on my personal account, was insane, just to show you how bad it was. Prince Chane saying, Premier Mokonyane, community mobilization and awareness is the key to all of this. That was what the Premier spoke about. Here's another one from Shane. All right, here's my Afrikaans, everybody. Stand by. Mense, ons kan nie drugs meer weg wat van hierdie land, South Africa, drug dealers, friends of police and government. Okay, that's another accusation against the police and South Africans and the friends. This is a big problem, and I cannot wait for our police commissioner to sit up there and answer these questions. Jake writing in and saying, Portugal has a perfect system. Legalize all drugs, increase rehabs. Jails is not the answer. There is no treatment in jails. Okay? That's just another comment from Jake. I'm not sure legalizing drugs is the way to go, but maybe that's just one opinion. And another one here, Manyovi Amnisi saying, to the Premier, she mentioned areas like El Dorado Park and forget about the people in the CBD, Johannesburg, and the sex workers there. Yeah, I've been there, I've seen it, and it is frightening. Shepherd Chauke, drugs are high here in Soshanguve. I really feel sad. I see someone at my age on drugs, and our community is crying for help. All right, everybody. So continue to send these comments through and questions as well. I know that the questions will start coming through as soon as we get our panel up there. Here's another one also talking about our borders. They're porous, they're corrupt, and underpaid officials. We must start at the bottom. This is perhaps a big problem. Another community that's being mentioned here, we seriously need help in the community of Nigel. Please send the President Jacob Zuma and the SAPS can't help us. You see, now that worries me. Here's another one. Megan, we need help in the community of Nigel. Oh, okay, sorry, it's the same person. The Gauteng Premier talked about breaking the silence and the bag on the fight against drugs in El Dorado Park. And here's another one, Chris Ndaba. Foreigners are manufacturing and selling drugs like fat cakes and are protected by the police. This is a fact. Right, lots of allegations, Peter. There are lots of allegations coming here. It's not the first time I've heard them. In fact, I remember going in Hillbrow and doing a broadcast there, and so many people accusing corrupt police officials of this. And I'm sorry to mention this, but this is what I was told, and this is what's being told here. I think if we can get this under the focus and under the spotlight, perhaps maybe we can get somewhere. Right, Peter, introduce us to your panel, and let's find out what more is going to be discussed this morning.
Leanne, thank you very much indeed, and welcome back to the Sandton Convention Centre just north of Johannesburg. And this is the venue for the latest in the series of New Age business briefings brought to you by the SABC, and we're taking a look at drugs. And whilst the focus is on Gauteng, please make no mistake, this is a national issue, and we're just using this as a platform to have this national debate. Please contribute at home to this conversation. We've got a panel that I'm going to introduce to you to now, and also an audience here at the venue that are going to help us do this conversation over the next hour or so. So let's introduce you to the panel. You've already met the Premier of Gauteng, Nomvula Mokonyane. Thank you very much indeed for joining us and sharing those words with us earlier on. Next to you, we have Darylene James, a concerned parent from El Dorado Park. And in fact, you're the one that set the cat among the pigeons, writing that letter and got people talking. And the president was so moved by what you did. So thank you for writing the letter. Thank you for being concerned. Thank you for breaking the silence. And thank you for joining us here today. Thank you very much, Darylene James. Venetia Orgel is next to you. She's a parent from Mitchell's Plain. Similar problems, similar concerns, and in fact, tragedy has visited your life as well, to drugs as well. So you're going to share your story with us, and I'm really excited to hear from the both of you, because you're at the rock face, and I think you represent mothers and sisters across the country, and brothers and fathers, I guess, at the problem. The man who's charged with trying to enforce the law and get drugs off our streets. Lieutenant General Mzwandile Petros, Provincial Police Commissioner, Gauteng. Sir, thank you very much indeed for joining us on the program. Welcome to you. And we look forward to hearing from you what you are doing and the kind of help that you need from our community. Somebody who's also very familiar to South Africans. He has many jobs, many hats, but the one that he's wearing today is the head of Crime Line, which is another vehicle that people can use to help break the back of crime in South Africa. Yusuf Abramji, always a pleasure to talk to you. I think the last time we met was in London. It was a cold day at the BBC. But thanks for joining us here today and to be able to share with us some of the initiatives that are out there. Okay, so a lot to talk about. We've got people at home who've already started to fire comments and questions, and we're going to get questions from here. The first one that's come through is that drugs have been with us for a while. This is not new. I think the moms have broken the silence a bit. So maybe perhaps, Premier, why now?
There is no moment that is not the right moment. And I think there's been work that has been done in South Africa to deal with drugs, but it has now been taken to a higher level precisely because of the communities themselves standing up and breaking the silence, getting organized and saying, we want to be part of those that are counted as being intolerant, and we want to act. And I think that's what is most important, so that then you do not just depend on policing, but you also depend on communities cooperating. We wouldn't have known the lolly lounges. We wouldn't have known who is the drug lord who's looking after a particular family or families at the Hillbrow lounges in El Dorado Park. We wouldn't have known where drugs are coming from into Kagiso, in Bangkok. But because the communities in Esteres have now come out through their priests, their churches, through the youth organizations to speak out and use every community platform. That is the difference. Darlene is a mother, and she actually said, this is enough, it can't happen, it has been too much, I need everybody to be with me, and I want to be part of those who must make a difference. And I think that's the success of this intervention, that is not just saying we need more policing. In fact, it says we need more partnership and less tolerance on the evildoers.
All right. We heard some cries from Shoshanguve, from Nigel, and I would say this is right across the country. Darlene, you're at the Rock Face. You started a conversation. Give us a sense, just in your area, what does the picture look like? What is it that you saw that made you cry desperately out to the president?
I was faced with I was living with an addict. My son has been an addict since the age of 14. And I'm sorry, I always become very emotional when I speak about this.
I understand.
And it was just going from bad to worse. It was just hell at home, where you can't go to work because you wake up in the morning and your blow dryer is gone, where you come home and household items are being stolen, where you wake up in the morning and he's taken oil and poured it all over the kitchen floor just out of spite, and you're falling and you're all messed before you go to work. It was a situation whereby from one school into the next school, out of hospital every year in rehab. I cannot remember when last we spent Christmas together as a family. It's been early hours of the morning, threatening me, telling me everyone's going to die in this house. He needs to leave. Eventually at 2 o'clock in the morning, having to open up the door and saying, I can't handle this anymore. It's okay, you can leave. I was also told by the doctors that my son doesn't have long to live because of what the drugs was doing to him. He was weighing 37, and I just thought, enough. I've been to rehabs, I've been to the police station, I've taken him from one school to the next school. He would get expelled. I've swapped jobs. I've been dismissed from work. Every year, it's just been a life of hell. And I just thought, enough.
And it's not just you, is it? I mean, it's everybody around you and the entire community. And that's El Dorado Park. But it's the same story in Mitchell's Plain. And your story, Venetia, is that you lost a son.
Yes, Peter. I've lost a son 5 years ago. He was an addict for 10 years. Troy tried to kill me on 3 occasions. Asked to sleep with me, wanted to rape his sisters, walked away from Cape Town to Joburg. Truck drivers would phone me and say, your son is either underneath my truck or on top of my truck. Bus drivers would say he's got onto the bus. Eventually, 5 years ago, we spent the whole week together. He was just taking me through his 10 years of ups and downs on his substance. And the Easter weekend, I was supposed to go away with my husband to Knysna, and I decided I'm staying home with him, and we spent the weekend together. And that was the weekend Troy enriched me with so much information of what a drug addict, how he or she suffers. He's
Oh, no, not a time to lose the link here. I hope we get that running up to you. This is a very emotional broadcast. I'm actually about to send a tweet out there. I was busy typing it up, just saying how I'm listening to these mothers. I think we may have the link up. I'm not going to talk too much. Let's see if we can hear the mother from Mitchell's Plains talking.
because he was living with a friend of mine, and I took him home. And the Tuesday I took him to doctor. He wanted to go to doctor. He wanted a blood test, because Troy was then clean for 3 years. And I took him to doctor, he did the blood test. Doctor sent him to psychiatric clinic. I took him the next day to psychiatric clinic. The nurses and staff, they asked me if my child needed to be hospitalized. And I said, I don't know. You tell me. They didn't hospitalize my son the Wednesday. The Thursday I was standing in Kenilworth Center in the bank, and I just decided there was such a feeling, overwhelming feeling, I needed to get to Troy. And I went, and he was lying on my friend's bed, and he gave me a message for each of his sisters. He asked me about Lisa, which is his elder sister. She was going for an operation. And then he asked me about Carla, and I said she flew out to Durban. And without thinking, he jumped out of my arms and he said, when will she be back? I said, she'll be back this evening again. She just went for a meeting. And then he asked me about Lyncia, and I said, she started a job, and he said, tell her to look after it. He asked me about Fallon, and I said, she's at work. You'll see her this afternoon. I'll come around here with her because I must pick her up at 2. He asked me to go buy him yogurts. And when I came back, I had left at 10 to 1, and his last words to me was, through the kitchen window, Mommy, remember I love you? And I turned around and I said, love you too, child. And I went to Kenilworth Center, from Nova Park to Kenilworth Center, because that is where he lived. And Auntie Lissy then was with me. And it was 10 to 1, so I was early for Fallon to come from work. So I went in and I did his monthly shopping, his porridges, his coffee, his chocolates, his chips that he has. And I went to pick Fallon up, and when we came back, he just didn't answer. And I went into Auntie Lissy's room, and his clothing was packed out on a bed from his suitcase. But his favorite jacket was put on the pillow, and his tablet and hospital cards was next to it. And then I looked into the bathroom, and I saw the rope hanging. And we had to kick open the door. I tried to breathe life back into him.
It was too late.
But I guess he's at peace.
I want to thank you for sharing your story with us, because I think it's representative of just how serious this issue is and how it's affecting people's lives. And the President heard your call. He came to visit, you had a chat with him, and we just want to play a clip of what the president said after that conversation, and this is what he said.
Having read the letter, having listened to the pleas to the government, I'm convinced that what has been said is sufficient for us to understand the depth of the crisis. What remains is, what do we do about the problem?
All right, so the president asking a poignant question. What do we do? And at the forefront of this battle is law enforcement. So Lieutenant General Mzwendile Petros, this is what the president said. What have you been able to do to answer that call? And at the back of this, I want you to address this question that's been put through already about perhaps some of your law enforcement officers are involved.
Peter, thank you very much. Good morning to everyone. If you look in terms of the problem of drugs, I think the president speaks to the crisis that is at hand. And the crisis is actually painted by the communities out there, the people that stood up. I think the premier talked to the issue that why now? There are those questions. Why now? El Dorado Park has changed to be, why didn't you intervene earlier? You get the community uprising that talks to say enough is enough. And in the past, you would actually be arresting the people and criminalizing the people. If we went into what the police have been doing in El Dorado Park, there were 279 dockets for just 1 year. But in the 2 years, there's been 1,500 dockets of people that were arrested. But when you're dealing with El Dorado Park, you're dealing with the market, you're dealing with where the consumption is. You're not necessarily dealing with those that are manufacturing. So the fight against drugs should be waged at two fronts. The first one being dealing with the market at the consumption level, at community level. And the second one, it needs to be an integrated approach in terms of dealing with the organized phenomenon, in terms of dealing with those that are manufacturing, dealing with the labs. But if you talk about Gauteng, you're not only dealing with the labs in Gauteng, you're dealing with the labs outside the country, where the drugs come into the country already manufactured. And then you're dealing with the international trend. Now, what is actually good about this campaign currently is to see the participation of communities. Let's go to El Dorado Park in terms of what the police are managing to do. It's not out of the cleverness of the police that we're dealing with the police. It's out of the goodwill of the people to bring information. Every day, Peter, the people are going to the police to report. What compromised the fight against drugs and crime? You would have heard the community saying they remove all the police here because all the police here that are corrupt. If we report cases, the cases are not taken anywhere, there is not much that is happening. It's out of the frustration that is there. We created the platform, an avenue where people can report in that place and dealing with it. What we managed to be tomorrow, which is the 14th, it will be the month since the president has been there. We've taken stock in terms of what has been happening, in terms of working with the communities. And indeed, there is really an improvement. It will be sustainable if there is this approach of partnership between the police and the community. We responded to the calls that were made in terms of ensuring that we're putting more resources in the place to deal with the problem. Now, we're looking at this, if we talk about the community in three phases. Phase one being the stabilization of the problem. If there is a crisis, we have to acknowledge that there is a problem. There is a problem. It is actually painted by the two community leaders that stood up and wanted to be counted in dealing with this thing. We stabilized the situation in terms of going into social crime prevention. Now, the premiers talked to the other approach that talked to other departments. We cannot relegate this campaign to those that are wearing uniform. This, including crime in general. If you want to fight crime, criminals come from the communities. They are brothers and sisters, fathers and their daughters. So at the end of the day, if the community is saying it's enough, we will be in a better position to fight this. Who can be against us? They will have the police behind them. Yes, of course, Peter, I will have to say up front, the fight against any crime, including the drugs, it gets compromised by those of us that are wearing uniform that will have their hands in the cookie jar, which becomes a problem. Community will never trust it. But the bad thing is that there are 300 police officials in the policing precinct. If 3 of them are involved in crime and the community knows, the whole 300 police officials are corrupt in the place. There's been calls at El Dorado Park before the president went to say the police are a problem. We changed the whole management of the police. The station commander is not even a year. I think now in June, end of June is going to be a year. His immediate subordinates that are working with him in the management are also new. The detective branch commander is new. The visible policing chief is also new in the place. But what we didn't manage to do is to change the police officials that are corrupt. You know, you sit with the problem. If I have to move the police officials that are suspected to be corrupt in El Dorado Park and take them to Johannesburg, I'm transferring the problem. I'm not actually dealing with the problem.
Okay.
The best place to put the police officials that are corrupt is behind bars. They change the uniform from blue to orange. That's what we need to be dealing with.
Okay. All right. So, but breaking the silence sometimes isn't that easy because a lot of these people are very powerful. And Yusuf, I guess an initiative like Crime Line helps with that.
Good morning, Peter. Yeah, a few general comments. I'm so delighted that the drug scourge is on the national agenda once and for all. And I think we need to compliment our partners within the media fraternity, the SABC, the New Age, and other media for coming forward and highlighting the plight that we have. For years, Peter, mums have been writing to presidents, to premiers, to ministers, and to the police, and nothing has happened. And it took one mum and some other ones that affected that wrote a letter to President Zuma that got him to El Dorado Park, for which we need to compliment the president and the premier. But I think let's leave politics out of it. For people to say that these politicians are doing it for the votes, I think is irresponsible. I say, let's vote against the drug dealers. Yes. I say the time has now come for us to stop the talking and really get to the action. 80% plus of the tip-offs, General Petros will tell you, to Crime Line and to Crime Stop are drug-related. We have a major problem. 80% are drug-related. The Minister of Health tells me that a large chunk of the rape scourge in South Africa is a result of the drug abuse or drug usage and the alcohol and substance abuse. I firmly believe that it's time for action. It takes active citizenry like we've seen in El Dorado Park that got the nation going. Let's turn every town, every city in South Africa into an El Dorado Park model, right? And as much as General Petros says he changed the management, General Petros, he might have to change the management of the whole of Gauteng because we have a problem. We're getting reports about police not acting, and we have to hold them accountable. They are accountable to the tax-paying public of South Africa. We have to hold them accountable. But more importantly, we need to find solutions. Peter, the Premier talks of partnerships. We have to strengthen the partnership between the public, the police, and the media. We have to get the public to blow the whistle on drug dealers. Fine, we will target the guy who sticks the Zol down the road. We will target him. But you know who needs to be the target? Like the Premier says, the big fish. These people who are living in fancy houses and driving flashy cars, we have to get to the drug dealers and the drug manufacturers. We have to keep our eyes and ears open. And how can we do that? We have to strengthen the partnership, forget the politics, and we have to get to action. Now is the time for action.
All right, okay. So we've got various ways that we can do this. Crime lines, report to the police, communities joining hands, breaking the silence, and provincial, municipal, national government taking action. I'm going to go to the audience here and also to the viewers, but just one quick question perhaps for you, Commissioner. What are the types of drugs that are out there that are problematic at the moment? And I don't know if you can give us a sense of costs and so on and so forth. Why is it such a scourge, and why are people making so much money? What are the drugs that you're seeing there? Perhaps even the parents can comment on what they're seeing.
I think the community will be in a better position, but I will be able to tell you that it depends on the economy of that particular policing precinct. Because if you go to the poorer areas, you will get what is called the Nyaupe. That is usually, that is the places like Soshanguve, Garangua, and also most of the township around Gauteng. But if you go to, and it gets graduating, what the Western Cape, they will call it the tik-tik. And it is also easily accessible. The accessibility of those drugs and the price of it is actually creating a problem. And it actually, the additive nature of those, the cheaper, the more addictive it becomes. But if you go to the places like Sandton, Sandhurst, and the Houghton, you get the cocaine, which is actually more and more expensive. There are various categories of those. And you have ecstasy, you have heroin. In Gauteng, actually, which is a distribution center for the whole country, because drugs come in here, they distribute it throughout the province. So you'll see the problem of the Western Cape might be coming from Gauteng. If you look at the interception that we're making in terms of those drugs being transported to the Western Cape and the arrest that we're making there, it's an indication that Gauteng is actually the hub of everything. The number of drugs that get closed are more here than anywhere else in the country. And of course, the cheaper the drug, you don't need a sophisticated lab to manufacture them. So that's where the accessibility becomes more and more.
Yusuf?
I don't think any particular area of South Africa is immune to drugs. If we think the Western Cape's got a problem, we're in for a shock. We launched Drug Watch, an initiative between the South African Police Service in the Western Cape, Leave South Africa, Crime Line, the Community Police Forums, the Metro Police last year in November. Peter, within 3 months, 15,950 people were arrested for drug-related crimes in the Western Cape alone, and 10 million rand worth of seizures were made. And General Petros is right. If we think the Western Cape's got a problem, Gauteng's got a bigger problem. And the point I want to make is that instead of us now pointing fingers, let us come up with a multifaceted approach. The Premier mentioned prevention, treatment, accountability, etc. Really, we have a major problem. The United Nations has declared the 26th of June as International Day Against Drug Trafficking. This is where the world needs to unite. Crime Stoppers International, of which I'm the Vice President, has identified drugs as one of the biggest contributing factors to crimes in the world, right? How do we tackle this problem? We have to find a solution. And let me tell you, the harrowing stories we're getting, Peter, from communities around Gauteng is shocking. School children are being affected. Mothers and fathers are on drugs. The children are taking the drugs with them. We've seen what happened in Eldorado Park. You talk of Westbury, we talk of Hillbrow, we talk of Sunnyside, and so the list continues. And if you think these drug dealers are operating in the Eldos of the world, we are making a mistake. The Premier said it 2 weeks ago. Go to the Sandtons and the Sunning Hills and you look at the houses that we live. And that's the point I'm making. We need action. We need these communities to blow the whistle on these people. And I don't care whether you give the crime to the tip-off to Crime Line or to Crime Stop, the police number, or to a policeman you trust. All we are saying to you is make the tip-off. And if the police fail to act, you go to Premier Nomvula Mokonyane or you come to me and we will then ask them to be accountable, because really, we've had enough of these drug dealers terrorizing our country.
All right. Okay. So I'm going to go to the audience now, but one question I'm going to ask the parents in a short while, and I just want you to think about it a little bit, because I'm hearing a lot about the what to do, the how, and that sort of thing. But I think perhaps prevention needs to start even further back. And the question we need to ask is, why do they get involved in drugs? So that's a question I want you to think about a little bit as we go to the audience now. Let's go to table number 14, Sydney. What's your question? Sydney, table number 14.
Thank you very much. My name is Sydney. I'm with a project called 3 Nails. 3 Nails is a recovery center dealing with the drugs substances. Because we found it's very important to come out and help those youth who are battling with the drugs. So my question is, why the government allow the spread of the drugs? So let the justice be changed in order to deal with this situation of the drugs amongst those who spreading them. Thank you.
Okay. Premier?
Yes, thanks. The thing that I've raised, an integrated approach is the solution. And there is nowhere where government allows the scourge of drugs to be on the increase. Part of what we're doing again, Peter, as Gauteng, we're breaking new ground. We're taking national government as well as our health institutions that are doing research on the issue of Nyaupe, that it can't actually be correct in this country, that Nyaupe cannot be registered as an addictive drug because of how it is actually being produced. And these are some of the things that we are dealing with, responding to the real material conditions working together with our health institutions and research-related bodies. Secondly, we are also saying we must deal with the issues of scheduling crimes that are related to drugs. It can't be a Schedule 1. It has to be one of the serious schedules, Schedule 6, which means it must really be linked to a crime that is almost like murder, rape, and all those things, including just sabotaging this country. Because we believe that it should be at that highest level so that then when punishment is permitted, those people can't go away scot-free with a 10,000 rand, because for a drug lord or somebody who is in possession of drugs, to pay an amount of 10,000, it actually is nothing. So we, as this province, working together with the SAPS, with our partners, Yusuf, communities and them, through the Department of Social Development, we are championing this cause on behalf of the country, and the President has agreed that we need to look at this particular intervention. On issues of properties and stuff, we are working on a blanket tool that gives us the legal authority to go in and not be asked to have a search warrant, because those properties are properties that belong to us. Last week I was in Eldos and I was saying, when these properties are being profiled, they come out as Gauteng provincial government, as the city of Tshwane. Those are our properties. So we need a blanket warrant that says we are reclaiming our properties, and we hope other institutions would actually not say we're violating anybody's right. This is in defense of our own rights and in defense of democracy.
Okay. Table number 2, Paul James. Table number 2, Paul James. Yeah.
Morning. I was a drug addict for 14 years, and I've since given my life to helping people overcome addiction through drug prevention and awareness, and I also work in a rehab center, more of a recovery center. And one problem we're facing at the moment is that we identify people who have issues with drugs, but the rehabilitation is so expensive in our country at the moment, and there's nobody willing to help there, you know. On average, it's between 15 and 30,000 rand for a 21-day program, which is insufficient.
I don't know, Premier, how do we deal with it?
That's for real, precisely because in the past, all of us were just looking at issues that are more dependent on prevention, through law enforcement. And as a province, for example, just in El Dorado Park alone, we're putting more than 8.2 million on supporting the rehabilitation centers. What is now of importance is to make sure that we integrate this rehabilitation into some of our primary healthcare interventions. We are rolling it out in Gauteng. We have identified some of our hospitals as other points of referrals, so that then families can't again be overburdened with this particular responsibility, and only those who can afford can be able to save their children. We have also made a plea, Peter, to say we want every center in Gauteng to be registered so that we know what happens in that particular center on the programs and whatever that they are giving to our children, and aftercare. That is one of the things, because in the last pillar, the issue was the issue of, the challenge was the area of aftercare. So we need a holistic approach. We need to make sure that we have forensic social workers, we have health practitioners who are able to deal with with our children, with victims, so that then, excuse me, you do not have this situation where your child or somebody who's addicted is sent back because people are saying he's not an inpatient. We need a multifaceted, it's already happening. We've placed children in some of our hospitals. Krisani, we've got 15 beds that we have put aside. In Tshwane, in Steve Biko, we're putting additional beds aside. We're working with Leratong now. We'll be going to Ekurhuleni, precisely because we believe it has to be this kind of an intervention. And we have learned. And that's why we're saying this one is a better intervention, because practice has told us that there has been gaps and the survivals have been those that can afford. But we throw our people back into the mud after we've taken them through rehabilitation. We must clean our communities.
All right. Moms, why are our kids doing drugs? What's happening? Because I'm thinking parents at home are thinking, What can they do to make sure that we prevent that? Why are they doing the drugs? Let's start with you, Darlene.
Speaking from my personal experience, my son was just experimenting at school, and you know, like kids are, they like to experiment and try new things. And he actually bought weed, and little did he know that it was laced with tick and with cat. So the 5 rand weed that he bought was laced and has now resulted in all of this. Everything is laced that our kids buy. You know, you find the oka pipe as well. Kids are smoking the oka pipe. As I drive through Eldorado Park, we're always confiscating this from the kids. We need to look into that as well. So and people are asking what drugs are these kids on? It's everything. Everyone assumes that it's okay to smoke weed, and people actually say, oh no, he's just on weed. Weed is actually the entry drug. That's where it all starts, and it's all about the chase of a better high.
Venetia, what's your experience? Why are children doing the drugs?
Peter, our children is becoming younger and younger. We're wondering about a 6 and a 7-year-old selling the drugs or using the drug. Let me be honest with you. I've got a daughter who was an addict. She's clean 2 years, but she's got 4 kids. And the nicest part, they use the drugs while they're pregnant. So our children are born addicts. If we now want to accept it or not accept it, we need primary care from day one when our babies are being born today. Our doctors need to look at what their child needs tests done. And we need to take it from there. Now, I've been doing this since 2003. I went to social services, Mitchell's Plain. We started the TIC task team. We did with Commissioner 2004 on the 24th of June. We did a massive march in Mitchell's Plain. Had the whole world there, right, Commissioner? We had ministers, everything there. Mitchell's Plain at that point had 12,000 kids on drugs, on TIC. 2009, Mitchell's Plain had 69,000 kids on drugs. You walk into a primary school and you're going to do a talk. And out of a primary school, you would find 400 of those kids have parents smoking in the very home that these kids are in. So our problem is much bigger than what we even think.
Peter, can I share with you as a parent? I have a child who has a problem with drugs. And it was because of my social responsibility, where he became a target because at that point I was the MEC for safety. And we're dealing with issues of stolen goods, and part of it was us dealing with corrupt police and the entire system. And he was trapped into that because people wanted to prove a point that they'll break Nomvula's back and the family. So when you deal with this issue, you also know that the battle is not about you alone. So it's not about parenting, and it is not only about what you think it's irresponsible mothers and irresponsible fathers. When you raise your voice and you fight against evil, they will find you la umncane khona. And I think it's also what we have experimented. I know of ministers, families, leaders in the police, community leaders who get targeted precisely because they raise this matter. And your children will continue telling you through therapy that I'm scared because these guys are hunting me. And I think if you are committed to defend this country and say any child is your child, you'll go an extra mile. And I think for me that's part of the anger. No longer interested on a person who's sniffing. I want these big guys because I believe I'm their own target. This country is their target. Our democracy is their target. We'll get them. And I think the question people must stop saying there's something wrong with parents. There's no mother who brings up a child with an intention to get a drug addict. You aim to have a Mandela out of your child.
Okay.
There's no mother who does that.
Thank you. Look, the crime line number is up on the screen, and I think it's, 322 32211?
Correct. SMS 32211. You can go to crimeline.co.za or you can call the Crime Stop number, which is the official police number of 08600 10111. 08600 10111. Can I just compliment
Yes.
the Premier who spoke about the son? Muxine Williams, the editor of the New Age, spoke about his nephew. And I think it's heartening when more and more South Africans speak up, like the mums have done, and share their stories. But more importantly, Peter, we need tip-offs. We need to break our silence. Far too long, people have been keeping quiet about their neighbors, their colleagues, and their friends who are involved in hijacking, who are involved in stolen goods. There's the MEC for Community Safety, Faith Mazibuko, will tell you. She goes out to communities. People are afraid. And we say to you, it's totally anonymous. We promise there is no comebacks. All we need is we need information about the drug dealers, the criminals, the who, the what, the when, the where, the why, and the how. Give us detailed information. Don't tell us drugs are being sold in Main Road, Hillbrow. It means little. Give us the number. Give us car registration numbers. Give us names if you can. And that's the only way we're going to create a safer South Africa is by passing on credible, detailed information. The police promise to act. The results speak for themselves. General Petros, Brigadier Malila will tell you, together with National Police, we've had thousands of arrests over the past few years. We've had millions of rands of seizures. And I can tell you now, the more information we get, the quicker we're going to reclaim our streets.
All right, okay, we're going to take a quick commercial break. After that, actually, I want to go back to Paul James to get his personal experience a little bit about the issues